you're having medial elbow pain right on the inside of your elbow. And that can be for a few different reasons. First of all, you could be having a tendonitis, which is basically inflammation of the tendon as it attaches onto the bone here, or a tendinopathy, which means you've had tendonitis multiple times until the tendon becomes degenerative because it's gone through that inflammatory phase multiple times, and so there's scar tissue and a few other things that happen to the tendon. So both of those are fairly common. One is short-term, the other is more of a long-term problem. Often what's happening is you're doing too much in a short period of time. So let's say you haven't played tennis for a few months or a few weeks, and all of a sudden you go out and you play for a few hours. And yes, your technique will be a little bit off, but if you're gripping the racket too tight, or you've strung your racket too tight, or you're just trying to hit too hard, all of that can increase irritation to the inside of your elbow and basically cause irritation that is too much for the tendon to tolerate. So it becomes inflamed or irritated, and then oftentimes people, as they're starting an exercise program, just continue to train through that because they say, it'll go away. And sometimes it does, but oftentimes it lingers and sticks around. And so that's the most common cause of medial epicondyle pain in tennis players and other racket sports, as well as throwing athletes. To best assess your medial elbow pain, what we would do in the office is first rule out any red flags. In the elbow, it's pretty rare for that to happen, but we're looking for tears, neurological conditions, and things like that. But that's pretty easy to rule out through neck movement, as well as some compression tests to make sure you're not getting any referred pain from the neck into the shoulder, elbow, or hand. So once that's ruled out, we'll take you through a full range of motion testing for your shoulder as well as wrist, and well, we've already done that for the neck. So that will give us an idea of, is there a restriction somewhere or an asymmetry that is causing either referred pain or a increased stress further down the chain. So once neurological symptoms are ruled out, as well as range of motion, then we do muscle testing to find out, are you weak somewhere? And also, if you're in a racket sport or a throwing sport, what we want to see is, during your motion, are you trying to use too much shoulder, or are you allowing the hip to do the work that it should be doing, and letting that force transfer from your legs through your torso into the shoulder, down into the arm, so that then you can have less effort in your arm and put less stress on the arm. It should just act more like a whip than it doing the majority of the work. So we take all of that into account, and then we come up with a solid diagnosis so that then we can offer you the best possible treatment plan. Once we have that clear diagnosis, then we start the treatment. There's lots we can do in office, where we do soft tissue work, all through the flexors as well as in the shoulders. Just depends on what's tight and restricted on you. We look at joint motion. So if your body's having difficulty getting into extension or dropping your scapula down, then we do adjusting for the joints and rehab for your scapular motion, as well as any weakness. So we loosen what's tight, strengthen what's weak, and make sure that your overall motion is fluid. Oftentimes we'll talk with your technique coach to make sure that your motion is as good as possible to reduce the total risk and irritation to your elbow. So strengthening, sometimes actually for medial epicondyle pain, sometimes dry needling is quite effective. So we get the needle and stick it right near that tendon or in the tendon, and then run some current through that to get as much of an inflammatory result as possible, which I know sounds kind of odd, but that's what stimulates healing. So we can use any one of those modalities. So adjusting to get your joints in the right place, massage therapy, or deep tissue work, or active release technique, things like that, to get the muscles functioning well, exercise to strengthen what's weak and stretch what's tight, and that combination works better than anything else I've seen, and will get you feeling better as soon as possible. So if you like what you're hearing and would love to come in and feel better sooner than later, give us a call. We'd love to help.